cervical spine consists of 7 vertebral bodies, which are interconnected by the help of a cushion like here. And this cushion is called a disc. It consists of 2 components. The outer component, it is made up of cartilage, which is strong, and the inner component is jelly, which is a soft. And the disc has 3 important functions. First, it maintains our spinal mobility. That's why we flex, extend, and move side to side. Second, it acts as a shock absorber. And third, it acts as weight transferring from vertebra above to vertebra below. So with time, as we grow older, it forms the cracks or tear in the outer coat through which the jelly piece pop out, and it can compress on the nerves and can cause a pain in the arm. This is called the degenerative disc disease. So the degenerative disc disease are more common in the cervical spine or in the lumbar spine because they are most mobile part of the spine in our body. So if there is a cervical disc disease, people usually complain of neck pain, neck spasm, pain in between the shoulder blade, pain radiating toward the shoulder, and then subsequently when there's a compression on the nerve, people do feel pain, aches in the arms, they feel numbness in the arms, sometimes paresthesias, and on careful questioning, they start losing dexterity in the hands to start with, and when it's reached to more advanced stage, they drop things from the hand. And if there's a compression on the spinal cord, people do feel that they are losing the balance, and in advanced stage, they become more stiff and wobbly. If the problem is in the lumbar spine, people usually complain of lower back pain, and then when there's a compression on the nerve, the pain starts radiating from the lower back down to the legs. And if we don't act at that stage, then the people start developing a numbness and then subsequently weakness in the legs. If it's a significant compression on the nerves, especially in the lower spine, it can affect the bladder, bowel, and sexual functions. So for initial consultation, if the patient has a short duration of symptoms, we offer a non-surgical treatment, which consists of physical therapy and pain management. And majority of patients usually get better. But if the problem persists or getting further worse, or if they are developing a progressive numbness or weakness in the arms, then we offer a surgical treatment. The surgical treatment for young people is a cervical disc replacement. It has an advantage over a fusion operation because it avoids the adjacent segment disease and future long-term problems. In the lumbar spine, I do a keyhole endoscopic spine surgery, which is better than old open operation because it's usually done as a day case, and people can go home quickly and their rehabilitation and recovery is much quicker and they go back to the work sooner. Yeah, I operated a patient, young, 35 years of age, 2 weeks ago, who presented with a long-standing history of neck and left-sided brachialgia since he involved with a car crash. And he was having this persistent pain for last 5 years. And he's tried all sort of conservative management, and nothing was helping him. He reached to the point that it's impacting his quality of life. He cannot sleep properly, he cannot have a family life properly, and he can't sit on desk and work in front of computer in his office. So he came to me and he opted for surgery. So he had a surgery 2 weeks ago, and I assessed him today, and he's completely pain-free in both neck and arms. His numbness is improved and he's got a full strength now. Pull this toward yourself, push me hard. Excellent. Can you squeeze my finger as hard as you can and don't let it go? Fantastic. Same on the other side. Very good. I think you looks very good and it's a great news. So I will see you once more in a 3 months time. We do a check X-ray at that point, and after that hopefully I will let you go completely.